What is hemophilia? Hemophilia is an inherited genetic disorder where blood does not clot properly. It is caused by a mutation in one of the genes responsible for creating clotting proteins. What are the signs and symptoms? Bleeding into the skin, bleeding after a vaccine, bleeding of mouth and gums, bleeding that is hard to stop after losing a tooth, overall excessive bleeding, mutation in the genes that provide instructions to form a blood clot. The disruption causes the protein to not be able to function, which causes the excessive bleeding. Medical problems associated with hemophilia include chronic joint disease and pain. Bleeding in the head can cause seizures and paralysis. Life expectancy varies, but it shows that those with hemophilia life expectancy is 10 years less than healthy men with proper treatment, and the death rate is twice as much than healthy men. The phenotype has different levels: mild, moderate, or severe. Mild bleeding is spontaneous bleedings that are rare and secondary to surgery or major trauma. Moderate bleeding is bleedings that are unusual and can be the result of a minor trauma or surgery. And severe bleeding is spontaneous bleeding since childhood. Can hemophilia be treated? The best way to treat this disease is to replace the missing blood clot factor, which is through the veins and is administered in an infusion of commercially prepared factors of concentrates. There is a group called HFA Families, which provides support for parents and caregivers of children who may have a bleeding disorder. There is testing done for children whose family members may have hemophilia. Testing is usually done soon after birth. There is genetic testing for those who have hemophilia and their family members. Some testing include carrier testing, in which they look for clotting factors in blood, or direct DNA mutation testing, in which they find mutations within genes through DNA testing. There is screening done for this disease. They do blood tests to indicate how long it will take the body's blood to clot, how much protein of blood clotting does the body have, and if any factors are missing. There is gene therapy available, which involves a modified virus that introduces a copy of the gene and that encodes for the clotting factor that's missing in patients. Hemophilia through the years. Hemophilia was first dated back to biblical times. It was referenced through various stories, such as the woman who hemorrhaged for 12 years before touching the hem of Jesus' garments. In 1803, the first article recognizing this disease as such was published by Dr. John Conrad Otto. By 1828, the disease had coined a new name, Hemophilia, which later was shortened to the term we know today, hemophilia. Fast forward to 1995, where prophylaxis treatment became the standard of care for hemophilia patients in the United States. Since then, we have begun research into gene therapy to find out ways of correcting hemophilia. While we still have not clinically applied this research, there is hope that we may one day be able to reverse this genetic mutation.